HIV/AIDS remains one of the most persistent global health challenges, claiming millions of lives, fearing through families, and testing the limits of health systems worldwide. While antiretroviral therapies and prevention strategies save lives, the pandemic continues to disproportionately affect communities with limited access to care. By the 90s, the epidemic escalated into a national emergency. Stigma, misinformation, and underfunded responses fuel its rapid spread, devastating millions of households and exposing major gaps in the country's health infrastructure. In response, the Nigerian government established a National Agency for the Control of AIDS (NACA) in 2007 to coordinate the national response, mobilize resources, and build strong partnerships to halt the spread. Periodically, NACA as a coordinating agency on HIV/AIDS program in Nigeria pilots the gathering of major stakeholders in the country under the umbrella of the Nigerian Council on AIDS. The Nigerian Council on AIDS serves as a pivotal coordination platform for stakeholders to deliberate on strategies aimed at advancing the national HIV/AIDS multi-sectoral response. From August 5 to 7, 2025, NACA holds the 7th National Council on AIDS at the Landmark Event Center in Lagos, with the theme, Advancing National HIV Sustainability Agenda in the Changing Global Policy on AIDS. On day 1 and 2 lined-up activities took center stage. The ceremony opens with a vibrant cultural welcome as dignitaries, health practitioners, government functionaries, and civil society stakeholders from across Nigeria gathered to reaffirm their commitment to a sustainable Nigeria-led HIV response.
Of the National Agency for the Control of AIDS in Nigeria, NACA, Dr. Mrs. Temitope, we thank you so very much.
From the opening remarks by the Director General of NACA, who doubles as the chairperson of the NCA, Dr. Temitope Ilori, to the welcome address by the LOC chairperson, Dr. Folakemi Animashaun, and the Honorable Minister of State for Health and Social Welfare, Dr. Isiaq Adekule Salako, who is the special guest of honor. The wife of the Governor of Lagos State, Dr. Ibijoke Sanwo-Olu, declared the event open while calling for bold, coordinated, and sustainable action to accelerate Nigeria's HIV response in the face of shifting global donor priorities. Day 2 witnessed technical section with different resource persons and various panelists deliberating on sectoral approaches for the sustainability of HIV and related development diseases.
Page 56. Memo number 07/2/46. Memoranda of local government involvement in HIV program sustainability. Recommended for approval after review. Is it approved? Thank you.
The event closing ceremony is graced by the Governor of Lagos State, Mr. Babajide Sanwo-Olu, who was represented by his deputy, Dr. Obafemi Hamzat. Director General of NACA, Dr. Temitope Ilori, set the tone for the day, stressing that Nigeria must fully own and sustain its HIV response as international donor support declines.
Our journey towards sustainability is a continuous one, and therefore we commit ourselves to continue to adapt and to ensure that the resolutions adopted during this council meeting will serve as our guiding light as we go forward. We must leverage on the momentum gained and accelerate the implementation of the sustainability plan, ensuring that Nigerians have access to comprehensive prevention, treatment and care, and the necessary support services.
Chairman of the House Committee on HIV/AIDS, TB, and Malaria Control, Honorable Amobi Godwin Oga calls for stronger legislative backing and increased domestic financing.
We are aware that over 70% of the resources for the fight against HIV/AIDS in our country comes from external sources. And we in the Committee on ATM will continue to advocate for increased domestic funding for the response against HIV in our country. Because I believe nobody can fight our battle more than us. It's high time we take this fight very, very serious.
From the global health community, other speakers highlight the shifting donor landscape and urge Nigeria to prioritize local accountability, innovation, and resource mobilization, as well as renewed grassroots awareness.
I want us to also have the boldness and confidence to address these new responsibilities, because indeed, we at the UN Joint Team make the advocacy that there is an NGO way of doing things and there is a government way of doing things. And this is the time for us to figure out what the government way of implementing this program will look like and how the government will finance this program. So it's in that confidence that we believe that Nigeria in particular indeed does have a tool to do the work of ending HIV as a public health threat in our country, to close gaps where we continue to be challenged, and particularly to put forward the work of states like Lagos State, who have been a significant forerunner in helping us to address these gaps.
I have been truly impressed by the deliberations over the past few days. I was also pleasantly surprised at how quickly the outcomes were produced and printed, ready for me to review this morning. It's truly, truly, truly indicative of the commitment that the government of Nigeria has made to sustaining HIV services in Nigeria. So I want to let you know that the US government remains a partner in helping us to sustain these most important life-saving services, and I look forward to continued work and partnership in ensuring that we sustain and maintain the gains achieved.
I want to sincerely congratulate you for the hard work that you've put into the resolutions. As the Commissioner for Health, we're going to take all these resolutions and define how we can place them into policy decisions moving forward under the changing landscape of global policy support around HIV/AIDS and other health issues that are prevailing in Nigeria and Africa. Sustainability is obviously the central theme, and I'm glad that you've placed so much focus on the issues of sustainability. As a country and as a state, we need to now take more ownership of HIV. We need to be responsible for managing the profile of HIV/AIDS in our respective environments.
In his address, Dr. Amzat reiterated the state's commitment to integrating HIV services into broader health system and strengthening community-based care, while also commending the NACA Director General.
We must educate our people to understand that in the first case, there are ways to prevent the contraction of this illness. So here in Lagos, we understand that commitment is not just declared by words, it is proven by action. Sustainability must not be a slogan, it must be a strategic priority. That is why we have continued to integrate HIV service into our broader health system, expanding access to community-based testing and treatment, and strengthening linkages to care. We launched the Lagos State HIV Trust Fund as a bold step towards sustainable domestic funding, and we continue to deepen collaboration with faith-based, traditional, and private sector actors. Our ongoing reform of the Lagos State HIV anti-stigma law demonstrates our belief in dignity, inclusion, and justice for all people, irrespective of living with HIV or not. We are aligning our HIV response with our universal health coverage agenda, because health must be equitable, accessible, and people-driven. So I must at this time appreciate the outstanding leadership of the National Agency of AIDS Control, and that's the DG, Dr. Temitope Ilori. Thank you very much for what you do. And of course, the leadership of the Lagos State AIDS Control Agency under Dr. Folakemi Ademasha.
Throughout the summit, representatives from state agencies, NGOs, faith-based organizations, and development partners engage in data sharing, peer learning, and collaborative strategy sections.
My takeaway is, in fact, the occasion has been very well, and I learned more lessons, especially on the sustainability plans. Lagos State, as people said, is a country of its own, right? They have tried, they have even started. But most of the states, actually, they are not well prepared on this sustainability plan. But notwithstanding, at least gradually, we will catch up. That is to meet it.
Yes, NACA has been doing a whole lot, but we think that there's so much work to be done because we want to see an end to HIV, AIDS, and stigma and discrimination. And also for the 7th National Council on AIDS, it's been amazing. And I think I will give kudos to NACA and also to Lagos State SACA. They've done so well in hosting this event.
As the 3-day gathering wraps up, the message resonates clearly. Ending HIV/AIDS as a public health threat in Nigeria requires sustained domestic leadership, grassroots involvement, and a unified national response.
Today's event has brought about all the stakeholders in HIV response in Nigeria, in which we have a collective resolve to now continue with the response despite the partners' withdrawal and some funding crunch. So now we have to look inward as a country to collectively fight this menace, integrating other services with the HIV response so that at least we can align with the other opportunities like the health insurance in the country and other health trust funds that can help in making sure that we fill the gaps left by the partners. So it's a disease that can wipe out the whole generation. So effort must be made to make sure that no person gets infected with the disease by 2030.
HIV prevalence in Nigeria has continued to reduce. The rate of new infection has continued to reduce. And this is as a result of the different programs that NACA and other stakeholders have put in place in Nigeria. We are not where we want to be, but we'll keep intensifying our efforts to ensure that more Nigerians test negative to HIV, and the ones that are currently infected with HIV have access to treatment and care.
This meeting is for us to dialogue, to sustain the gains we've made. I would say that as Nigeria and as Nigerians, we've actually made good progress in trying to eliminate HIV. We've not yet met the target, but we're working very towards the target. Also in the area of prevention of mother-to-child transmission, reducing new infections, these are areas that we've made progress. But we're saying in the face of the dwindling global resourcing, there's need for us as Nigerians to actually come together and take ownership. And part of the resolutions is to say that government at all levels, should take ownership of the response. We should increase budgetary allocations. We should improve on our domestic resourcing and ensure that we strengthen our structures, our government-mandated structures, to be able to do the work that some of our donor partners have been doing in time past, so that as a result we'll be able to forge ahead and to achieve the target of eliminating HIV as a public health threat going forward. The resolutions we've made, we turn them into policy brief, we turn them into we share with policymakers, and they become policy, they become roadmap, they become framework that guide our response, both at the federal and at the state level. So this is because representative part of the council, we have delegates from all the 36 states of the federation and FCT. So as we conclude now, they will go back with resolutions and work with it, in implementing the necessary changes.
The 7th National Council on AIDS is not just a reflection on past progress. It emerges as a rallying cry for Nigeria to build a future of health equity, resilience, and self-reliance.